Naima with Jesse and our special guest, Dr. Scurlock. And want to say hi and welcome you guys to the new year. This is the first one that we've done now, and it's really exciting to be here with all of you. This is a great opportunity for you to speak with Dr. Scurlock, have all of your questions answered, and also speak to our beautiful brand ambassadors and ask some things as well. This is our first one doing it on YouTube because the last one was on Instagram Live. And you're going to be seeing lots of us in the future because we're going to start creating this as an ongoing like podcast about plastic surgery, relationships, girl talk, a little bit of everything.
It might be a little out of place.
Welcome, Dr. Scurlock. I know that today you've had a couple of cases. Do you want to talk to us a little bit about what you've done?
Sure. I stayed up all night with my new puppy. So it started like that. Oh, no. I don't like when people say it's like having a baby. It's legit like having a baby. Like just crying throughout the night. Either way, that's not what you're asking about. But obviously that's what's on my mind. So today, a little bit of everything. I started early this morning. Did some tummy tucks, lipos. Just finished with mommy makeover. Oh, great. I'm excited. I might post that one later.
Great.
You know, that's good.
Beautiful. So if you want to see the results of that mommy makeover that he's been talking to us about, because he has been just make sure you follow him on Instagram. And what's your Instagram account?
At Dr Scurlock. Probably can't read it.
At Dr Scurlock. Okay, DrScurlock. Yeah, you know I got to spell. Thank you. And we have a couple questions from patients. And then the first one, because I know safety is so important for you. What do you do in the OR to make sure you have a safe and successful surgery?
So that's kind of a loaded question depending on what surgery you're talking about. The big thing that happened in Florida recently was limiting the amount of EVLs that you can do every day, which I wasn't doing over that amount of EVLs either way, but then adding ultrasound. I think ultrasound's a little superfluous in that as long as you're not injecting into the muscle, it's adding another layer of safety, but maybe a little bit above and beyond. Yeah. Otherwise, surgery-wise, I'm just very algorithmic. I do everything the same way every time, like down to like where I'm standing at the table with what instrument I'm using. And I think when you kind of follow an algorithm, and any time that you deviate from the norm, like your brain is picking that up, that you're forgetting a step or you're forgetting a spot where you normally do X, Y, or Z.
Do you even have an OR playlist?
I do have an OR playlist.
So even the same music gets played.
Yeah, and that annoys the living crud out of my team because they're tired of hearing the same music.
Are you like that methodical in every area, every aspect of your life?
You very much know that I am not like that whatsoever. Like with plastic surgery and cosmetic surgery, it's the only thing that I'm really type A about, and I just am so, it's like frustrating. I feel like I'm going to die young because I just spend so much time and energy in the little details that it stresses me out. And even when patients look great, I can still find that little thing that I don't like. And I'm like that in no other area of my life, but apparently I put all of that energy into this.
Right, but I think that's actually a good thing, even though it drives you crazy, because I know how much of a perfectionist you are. We've been working now for like 2 years, and so I know how much you stress about every single one of your patients, but that just speaks volumes about who you are as a surgeon and how you really care about your patients. Like, let's just throw, some implants in there. Whatever, it looks fine. Gotta go. Fine. Like, he really cares.
Like, if we're critical of our own bodies, I appreciate that someone is the same, so I don't have to look in the mirror and be like, I wish they would have fixed this or done that. It's like above my expectations, and you understand female body and what we're looking for and what men are looking for if you're getting it for so everything's like.
So what I've found in myself as a challenge with that though is that I'm so hypercritical of like my own work. I don't want to give anybody like a complex. Like sometimes, I'll do a surgery on them and they're just like so happy, and I'm like, yeah, but that one little spot right there, like I could have like maybe, and you don't want to get them thinking about it too much. But yeah, I totally agree.
And Jesse, I think you had a question, right?
Question about breast implants. So, do you choose the size of the implant, or does the patient choose the size?
So sizing is, it's between both of us, really. I'm going to tell you what's safe. So if I kind of label people into 3 categories. They're either natural, and like you don't necessarily want people to know you had implants. There is like bubble, where it's like, I don't care, I want as big as I possibly can get. I haven't had breasts, and like, let's go. And then there's like where most people fall, which I call like the natural fake. It's a little bit bigger than natural. People would probably know that's a little bit too much bust, a little bit too much cleavage to be natural. But when I kind of figure out where you want to be there, that helps me start giving you sizes. And then other patients will come in though and just say, I saw this is what I like. They have everything researched.
Yeah.
I want it under the muscle. I want that. And as long as it fits, I'm not trying to change your mind to something else. But it's so subjective, right?
Yeah.
Like all women want something different with their body, and it's not really our place as surgeons to tell them, no, this is what you want or this is what you need.
Right.
You're like a body mechanic, right? You come in and you want this fixed, and then you should fix it to the best of your ability, but don't try to project your own thoughts on it.
Right. And that's a great question because for us, for women, for patients, when you're saying if we can choose our size, we're thinking of cup size. Like I want to be a C because I'm a B, or I'm an A and I want to become a double D. Doctors are looking at it at how many cc's, right? So normally a patient doesn't come to you and tell you, I want to be 500 cc's. They normally tell you, hey, I want to be a D cup. And then you have to figure out based on what they have currently, how many cc's they have to go to achieve that.
Yeah.
Right.
Yeah. And cup sizing in general is, all women know, it's so arbitrary.
Yes.
You can go to Macy's to buy a bra versus like Victoria's Secret, totally different sizes. So when you come in saying, a lot of women come in and say, I'm a C cup, and me looking at it medically, I'll think, no, that's like a little B or like an A. But if they're at Victoria's Secret, it's like, so you kind of get it all thrown off.
What size are you in Victoria's Secret?
I'm a 34 triple D.
And you?
32D.
Yeah. And I'm
So most people, a D is huge, but
Yeah.
it all depends on like your back size and all those kind of things. So it's all
I'm a 34, 36 triple D as well in Victoria's Secret. But then you go to somewhere like Macy's and you'll get like one of those other brands in Made in Form or something, and
Yeah.
you're just like a double D or a D.
double D. And also, with like our menstrual cycle, our breast size changed a lot.
Oh,
too.
for sure.
Yeah.
They definitely change throughout the month. So patients and you work together to figure out the best size for the patient.
Yeah, definitely.
Okay, very good. And a patient was asking about very good. What does Dr. Scurlock do for patients, for his mommy makeover patients to help manage pain post-op? How soon can you go back to work after a mommy makeover, and how many massages should you get after surgery?
Sure. So mommy makeover is really all cosmetic surgeries. Pain should be managed like multimodality management, right? So starting post-operatively, you're going to be on Tylenol, Motrin, gabapentin. You could need Flexeril, which is a muscle relaxant, as well as oxycodone or a narcotic. Mix that with really anything that helps: massages, warm compresses, and anything that you can throw in to try to help with the pain. And then we also offer Exparil, which is a long-term pain management injection that we can give in the musculature during the tummy tuck to help numb it up for 3 days.
Okay. So now talk to me more about this dog, this little dog that you have.
Yes.
You hooked us on that dog, on that puppy. I want to know the name, boy or girl.
Yeah.
What kind of breed is it?
So Ruthie is been a puppy that my daughters have been asking for forever.
Oh.
And she's a red golden retriever, and she's 10 weeks now.
I love golden
Yeah.
retrievers.
Yeah, she's
The
adorable.
best.
But I mean, she's fun. Golly, it really is like having a baby.
Yeah.
Like it's the only thing that's easier. It's like it's in a crate.
Yeah.
It's in a crate. And when they cry, you're kind of like, all right, stop.
Yeah.
You get a little bit more emotional, as you know, about your baby crying, as opposed to the golden retriever. So that's the only benefit. But
Yeah.
I
Kids are liking it?
oh yeah, they're obsessed.
They're loving it?
Absolutely.
And
Which is fun.
are you training her?
I am a dog trainer right now.
You're a dog trainer.
Most definitely.
So he's a cosmetic surgeon / dog trainer, and if you're looking for dog training services in the Coral Gables area, then
Absolutely not.
contact Dr. Scurlock.
Definitely.
And what is it that you're going to be doing today after you leave here?
So I'm going straight to soccer practice,
So he's a soccer dad too.
and then golf. I'm trying to get my daughters into golf because I'm obsessed.
Uh-huh.
And so that's like my back way into being able to golf.
Yeah.
Is that if I can get the kids to go with me, then my wife will be all about it.
So, actually, there's something that you were just talking to me about, the play at
Yes.
Hard Rock.
So at the
You
Hard
should
Rock,
go.
they have like an indoor interactive like play thing, and they have golfing, soccer, football, it's like a sports bar and all that kind of stuff. So it's like
Cool.
fun for your family.
Yeah.
Yeah.
That way it's like a whole fun day with the kids and you
Yeah.
guys can like play and talk about.
Yeah, exactly. I did that. We just did that recently.
Yeah.
You liked it?
Oh, it's great.
I'm like really good at golf.
Really?
I had no idea that was a top golf. I was throwing the balls like
Yeah.
so far. I'm
Wow.
surprisingly really good.
I'm horrible
No,
at it.
it goes like
I'm
that.
so bad at it.
Yeah, like I'll hit it and somehow it's
It's like everybody should do it at least once because maybe you have like a hidden
Yeah.
talent.
Yeah.
Yeah, exactly. Alrighty, well, one last question.
Yep.
If you could be in any TV show,
Show me what.
current TV show or like old TV show, which one would it be?
I mean, back in the day, it would have been something like Real World.
The Real World?
Oh yeah, or like Jersey Shore. Just
No.
straight, just straight garbage.
Ugh.
Like,
Wait,
I
are
would
you
just
gonna be like
oh,
a
oh, yeah.
member of the house on
Oh
Jersey
yeah,
Shore?
like Gym Tan Laundry. I would be
Yeah?
all about it.
Okay,
Oh yeah,
bro.
just, yeah. We had to be. That's what
Oh my god, I totally see Real World, but
Is that how you were like in college?
I was a mess when I was a kid. Yeah,
Yeah.
for sure. Like really, not until my junior year of college did I finally sit down and like get serious about.
he was a
education.
football player, like in college, and then he was in the league in Europe.
That was so. It took me a while to figure out
Were you a quarterback?
Yeah.
Of course you were. Of course he was. a
Gym Tan
quarterback.
Laundry and quarterback.
Yeah, alrighty. Well, we've known all this about him. He's a dog trainer, he's a soccer dad, he's a football player, and he's also the GOAT of tummy tucks here at Avana Plastic Surgery, and I'm sure that you know all about it because we are obsessed with your results. And it's been a true pleasure working with you for the last 2 years. So thank you so much for being part of the team. And I'm gonna let you
Yeah.
go
Yeah.
now. I'm gonna let you go now. Thank you so much, and say hi to Doc for us.
Oh, I will.
Okay, so guys, if you have any other questions for us, and maybe there were some questions that Dr. Scurlock didn't answer, or you didn't have the guts to ask him, remember, there's nothing here that is off the table. You can ask anything you want. That's why it's called Uncensored and Unfiltered. So make sure you ask us, and if you're too shy to ask it here in the chats, go into our Instagram account, send us a DM, and let us know privately, and we will be answering it for you. As you know, we're here located in Miami. I'm not sure if you guys know, we actually just launched a breast augmentation contest.
oh,
Nice.
So remember, ladies, if you want to be part of this contest, there's just a few rules. Very, very simple. We're going to be announcing it right after Valentine's Day. And it's a great way for you to get the boobies that you've always wanted. So it's a really exciting campaign and contest that we're doing for all of you back at home. And a question we had was, if you had to live in the United States, you don't have to live in the United States. You can win. You don't have to live here. You just have to be able to get to Miami. So just make sure you can legally travel to Miami to get surgery, and your whole surgery is covered. And we are so excited to announce the winner because we actually had a BBL giveaway.
yes.
And then now we're having the breast aug giveaway for Valentine's Day.
It's on your Instagram?
Mhm. And after the breast aug, which one do you think we should do next?
Or maybe a
Yeah, something like that.
Yeah. Oh, for
What if
Mother's
we-
Day.
Oh,
Is
right?
it possible that one person can be so lucky to win?
I
Because
mean,
it's random selection.
it's random selection.
Wow, test your luck, guys.
Yeah.
Maybe
Can you
can win more
imagine?
than one.
That'd
Yeah.
be great. Yeah,
That'd
that
be
would be very
amazing.
good. Oh my
Yeah.
God, that'd be a complete makeover.
Yeah.
Yeah, so I think we should do that for Mother's
for
Day.
Mother's Day.
We should do a tummy tuck.
Yeah.
Yeah, because a lot of moms come to us because they feel like they want to get their body back to how it used to be after having kids. And one of the things that we actually get asked about a lot is loose skin. If you don't have enough loose skin for a tummy tuck, what can you do with liposuction? There's something called Renuvion, which is popularly known as J plasma. And it's a technique that's really fantastic, and it's an add-on to any liposuction procedure, and it tightens your skin. So if you have some loose skin from either weight loss or pregnancy, but you don't have enough for a tummy tuck, or you don't want to commit to that scar, then check out Renuvion. It might be an amazing add-on to your procedure, and a lot of our patients get it done in conjunction with their BBL.
Is Renuvion only on the body? Or can you do it on your chin?
You can
Or
do it on
it's
your
like-
chin.
Okay.
Yeah. So sometimes if you gain a lot of weight, or you have some loose skin here, you could do a little bit of liposuction or not. And maybe you just want, when you take out that fat, you don't want that loose skin to hang, and it's just gonna really retract that skin back, and it's gonna make your chin look like great.
Chin lipo is very popular.
Oh,
Yeah.
for sure it is.
That, and I've heard of,
Oh,
The buccal fat.
yes,
that
yes.
one.
Yeah, so buccal fat is something that's a little controversial, because, and I know about this because I was thinking about doing it too when I was a little younger, when I was like your age, and buccal fat is very attractive at first. And what you do is you make small incisions inside your cheeks, and you take out like a little pad of fat. Everyone has a pad of fat that cushions your cheek. So when you're younger, you have more of that cushion.
Right.
But as you age, your skin, your face starts to hollow out.
Right.
So if you take out that buccal fat, when you make this, when you're 10 years later, when you're 35, 40, it's gonna look even deeper.
Yeah, I love the whole like when you're younger, that like fat here, or even when you lose a lot of weight and you lose that, it gives like a youthful look to your face. So it's like, personally,
Yeah, like you just want, and it's fine.
Yeah.
Maybe there's some patients that say, I want like the immediate gratification. I want to look amazing
yeah,
with those high cheekbones now. I'll worry
Right.
about it in the future.
yeah,
Or you could say, look, I'm gonna have that little chubbier face now. It makes you look more youthful.
yeah,
Yeah, and then because that's something I'm like now I'm thinking, thank God I didn't do it.
right.
Right.
But okay, let's say if you don't want to take out the buccal fat, could you do filler to give yourself cheekbones, like adding something rather than taking it away? So you
For
still
sure.
look young?
You could. And
Oh.
not just fillers. Like let's say, all right, G, I already did it. I got buccal fat removal a few years ago, and now I'm starting to see that I have it too hollow. What can I do? So there's two things you can do, and we offer both of them here at Avana Plastic Surgery. One is the fillers. The fillers is temporary. It's going to fill it out so you look more plump, more youthful. It's going to help you with these lines and Marie Antoinette lines. Another thing you could do is your own fat. So just the same way that we remove fat and put it in the butt for a BBL, we can also remove fat and put it in your cheeks.
You could basically remove that from anywhere
Yes.
and put it.
Yeah, but not all fat is created equal. Though, like there's some fat that isn't as great as other fat. The best fat is like the ones on your back and your tummy. That's like that's squat
Yeah.
fat. And then the ones in the arms or like inner thigh, it's not like the best one.
So, what are your thoughts on like taking fat and doing like vaginal? Is that vaginal rejuvenation? When I've seen them fill like your vagina lips,
Yeah.
With
So
fat.
vaginal
I didn't
rejuvenation.
know this was a thing.
you can get
So you
your-
could have like a fatter
yeah,
kitty.
yeah. Like you can change it. They have something called like a roast beef. If you've ever heard of it.
Of course.
Okay, so it'd be like
Uncensored and unfiltered.
Yeah.
We're talking about roast beef here.
yeah. So if you have like a roast beef, I think they can like fix that.
Yeah, they could.
Yeah.
So if you have a roast beef, like what we would do is we would trim a lot of the excess skin that makes it roast beef looking, which is really just a thinning out of the skin of the
Okay.
tissue. And then what we would do is we would inject fat into that area to make it look more plump and youthful.
And what's the downtime? Like I don't have roast beef. I'm just thinking, asking. I'm answering the questions that you guys want.
But if we had roast beef, would we really say it
I think I've heard of some people that are proud
of their roast
of
beef?
the roast beef. It's everything is positivity and whatever you have, because there's people who literally probably really love like
Roast beef.
Like that's what they.
I'm more of like an Italian BMT
Yeah.
stuff.
I have to consider myself a flower.
Yeah.
Yeah, like a flower.
Like a flower. Yeah. Oh my gosh, it reminds me of Jane the Virgin.
We're talking about delis here.
Yeah.
Deli.
Oh, yeah.
Okay, not flowers.
Yes.
I remember that.
Yes, and she was like, it's like a flower, and she's like, crush the flower. But
Well, again, and that's actually a really good question, right? We are so open about plastic surgery. Everyone's like, yeah, I got my breast done, or I got my BBL done, I got my lipo done. But would we ever admit, like, how much is it? How much is too much? Would we ever admit if we got vaginal surgery to fix the roast beef?
no, because that's a part that like, it's like a little more private. My boobs, you're gonna see in my outfit, you're gonna see whatever, you can see those things, but like anything underneath that you can't really see, I wouldn't say.
Right.
Like
That's
I
just
wouldn't
between
like,
you and
yeah,
your.
like Happy Thursday,
and your
have my
partner.
vagina rejuvenated. Like I wouldn't like
Come with me.
Yeah.
Let's go see this.
exactly. Like I wouldn't stay, but I have seen like videos of it, and it looks
Yeah.
really interesting.
I
It
would
does.
say I'm not afraid to. I don't like keeping secrets.
Yeah.
Yeah,
I like people.
You're pretty open.
I'm very
person.
open.
Yeah.
I would say.
I don't know how I feel about it. I am at at a point in my life where I really just, I don't care what
Yeah.
people think or what they say, but at the same time, it's like that. It's like I guess that old school mentality where I think I would kind of keep that secret,
Yeah. You need some sort of
right?
Yeah.
But you know, it whatever anyone wants to do.
Well,
We do offer here at Avana
Yeah.
Plastic Surgery. Yeah, definitely. And it's
Yeah.
something that a lot of women do. And it's actually great. It's a great procedure to do for patients. So, and by the way, if you have and this is actually a question about scars. If you have a C-section scar, your tummy tuck scar will cover it. Like it's not going to be like your C-section scar and then your tummy tuck scar. The doctor will always go through and we use that same incision. So you don't have to worry about having double scars at any time. Do you guys have any other questions or comments today?
I feel like I do. Let's see. How big is too big? Of like, if someone were to get their BBL, your
We're
personal
talking about BBL.
Yeah, like
That's a
what
good
would you think is
question.
too, in your personal opinion, what is too big?
If I can tell that you have a fake butt from the front,
Yeah.
then it's too big. Ooh,
Okay. That's a good one.
like if I can see it like coming out of your hips, then it's too much. And I'm a huge fan of it matching your legs.
Yes.
It cannot look like two balls and then like stick legs.
Yeah.
It has to really go with your body type,
Yes.
right?
Yeah.
I have a follow-up question to that. So would you ever say no? Or would a doctor ever say no to a surgery? Let's say a person has had 2 BBLs and wants a third one. And for whatever reason,
Yes.
would you say no?
Yes. So we really think first about safety. And there comes a point where it's just not safe anymore to do it because it's scar tissue that we have to break up. Once you start putting too much fat into it, then the patient can suffer things like necrosis, which is basically like death of the fat. It's not fun. So we have had to do it in certain circumstances where we have to put the patient's safety first. And also for aesthetic reasons, if a patient tells us, but I really want a very exaggerated butt. I want it to come out here, and I want it to come out here. And I want to look like an anime, like dog. If it doesn't go in line with what the doctor's aesthetic is, he could tell you, I'm not the person for you because I don't think that that's going to look good for you.
Right.
You know? And he wants, obviously, just the best for you.
Yeah.
And just the same with breasts. Like there are patients that have come to me have said, I want to get 2,000 cc's put in. And we've had that before, like where she's got 1,400 cc's and she wanted 2,000 cc's. And the doctor said, absolutely not. I cannot do it. Find someone else to do it. We'll give you back your money. Find someone else to do it. But it's not safe and it's not going to look good.
Yeah, like safety. As I learn more about plastic surgery, I understand like the safety reasons.
Yeah.
Before, my mindset was when it looks like that, I would think, why would they look like that? I would blame like, did the doctor not tell her? But it's like a lot of people just really want that exaggerated look, and it reflects better on the doctor, and you see like their true work because this is art. It's like it's an art, it's a science.
Yeah.
It's like they're creating something so beautiful. So if you're gonna ask them to create something that's like
It looks very
cartoony, then you wouldn't want that to look like for people to think that
That's your work.
their work. You know?
Exactly.
You need to find the doctor that matches your aesthetic.
Yes.
Absolutely. Exactly. So, on that note, we want to thank you so much for joining us today on YouTube Live. Very soon, we're going to do one with other special guests. Thank you so much, and we'll be seeing you soon.